Palak Beriwala. I'm a health coach here at Besugarfit, and today I'll be telling you all about diabetes one step at a time. So what is type 2 diabetes? Type 2 diabetes is a chronic and lifelong condition that is characterized by the inability of the cells to respond adequately to insulin, a hormone that is responsible for carrying the sugar from the blood into the cells where it is utilized as energy. Due to the inability of these cells to respond to insulin, the blood sugar level starts rising and the body is forced to utilize energy from alternative sources such as the muscles, internal organs and other parts of the body. The first question that might be coming to your mind is that how does one know that they have diabetes? The problem with diabetes is that the symptoms might go unnoticed, making it difficult to diagnose diabetes. There are certain symptoms that might be very easily recognizable, so here's a couple of them. First is increased thirst and urination. This is the body's way of trying to get rid of the excess sugar that has piled up in the blood. Second is increased hunger. So the body, because of the lack of energy, is going to try to eat as more as possible. So you might be feeling constant urges to eat. Third is unplanned weight loss. So unnoticed or unintentional weight loss is another symptom that you might notice. Next is fatigue and tiredness. So because of the lack of energy, the lack of stamina, you might be feeling very tired and very lethargic throughout the day. Delayed wound healing or wounds that might not be healing faster or they might not heal at all is another symptom. One major symptom or one major warning sign is blurry vision. If you notice this, it is time to visit your doctor. There are certain factors that might be putting you at risk of diabetes. First being age. So anybody over the age of 45 years has a higher risk of developing diabetes. Second is obesity or overweight. So if you have unhealthy eating habits which has lead on to putting weight, that might be another risk factor. Third is lack of exercise. So having a sedentary lifestyle with inadequate exercise can put you at higher risk. Fourth is smoking. So smoking has also been linked to higher risk factors of diabetes. Fifth is the most important one, family history. So if anybody in your family, your siblings or your parents, grandparents have diabetes, that puts you at a higher risk. Sixth is having high blood pressure. So high blood pressure can also put you at a higher risk of diabetes. How is type 2 diabetes really caused? So there is the pancreas in our body, an organ which produces the hormone called insulin. This is responsible for converting the glucose into energy. So glucose is a form of sugar that we get from the food we consume. Once it gets broken down, it is converted to energy. When the cells are unable to harness this energy, the blood sugar levels start rising, which causes various other problems. So the main cause why diabetes happens is because the body becomes insulin resistant, where the cells are not being able to respond adequately to the insulin that is produced, or the body is unable to produce adequate amount of insulin, which ultimately causes a rise in blood sugar levels. Genetic factor is also a very important cause that might be playing in. How does one really diagnose diabetes? So there are various tests which along with the symptoms can help a health professional to diagnose diabetes. First being the glycated hemoglobin test. So this is a test which is performed in order to get the average of the blood sugar levels over a span of 2 to 3 months. Second being a random blood sugar test, where the sugar test is done from the blood sample, and this along with accompanying symptoms can help us detect diabetes. Third being the fasting blood sugar test. So here the blood sample is collected from the individual after they have fasted for at least 8 hours to negotiate the effect of any meals or any food intake that might have happened. At least 2 tests are required to diagnose diabetes. Last test being the oral glucose tolerance test. Here an individual is administered a liquid and then the sugars are monitored over the next few hours. This is a very uncommon test which is generally done mainly for pregnant women. So if you are in the age of 45 years along with obesity or overweight, it is very important for you to get these tests regularly to diagnose diabetes at the right time. important question is, how does one really treat type 2 diabetes? So a mix of both lifestyle changes along with medications is required to do that. Visiting an endocrinologist is the first course of action, of course. When coming to lifestyle changes, it is very important to lose weight and also to adopt healthy eating habits. Swapping your unhealthy, fatty, less nutritious foods for more nutrient-dense varieties is the way to go. Along with that, you must be more physically active, and this can be achieved by performing exercises like yoga, strength training, and cardio. Along with these lifestyle changes, constant monitoring of blood sugar levels is also very important. When these lifestyle changes do not work or are not being able to give us the results we desire, our next course of action is medications. Metformin is one of the best medications that is used for diabetes, as it helps our body respond better to insulin. If that does not work, there are other medications and even insulin shots that might help bring the blood sugars to the normal level.